All right. Well, then I'm just going to go to our minutes from June, and we'll just kind of follow along with that. So we did have our steering call, and thank you for those who were on that call. That's always the second Monday, so we did that on the 10th, which was last week Monday. So that was really helpful. We talked about us being part of the long-term support services. It was kind of interesting, a webinar I was on where they were saying assisted living homes. They were kind of bunching them in more with home and community-based services. And I thought that was kind of interesting because we've kind of affiliated ourselves with assisted living homes. And I wondered if anyone had any thoughts about that.
What do you mean you've affiliated yourself with assisted living?
Well, in other words, when U.N.I.T.E, when we kind of first talked about this collaborative, we wanted assisted living homes to be part of what we were doing. And I don't, it was kind of interesting on this tribal call that they talked about assisted living facilities more as part of like home and community-based service.
Yeah, I'm just kind of thinking, my bias on the assisted livings that I see in Alaska is just that we've got so many with so little oversight. And they are oftentimes, and actually Teresa can speak to this more than me, but what I'm kind of seeing on the environmental landscape is just a lot of little mom and pop kind of facilities where they don't have much support, nor do they have the ability to, well, and I say the ability, I think it's very difficult for them to find time and staff and so forth to do things like participate in something like U.N.I.T.E. I get the feeling that they're just scraping along. Teresa, you work with the assisted livings and I don't, so you're in a much better position to actually speak intelligently on this subject.
Well, in Alaska, though, we have 4 tribally owned assisted living homes.
Okay.
So we have Barrow, Dillingham, Galena, and Canada. So
okay.
They might be interested.
Mm-hmm.
Barrow, Dillingham, Galena, and where? Canada?
Canada. And I heard rumors there's going to be one in the Pribilof.
Okay.
Oh, wow.
Do you know what their census is? Like, do they have like 10 beds or 5 beds or?
I think they're all small, like 10 to 15.
Because ours, the one that we have here, just a stone's throw away from our nursing home, is a 12 bed. So,
these are all about.
Honestly, Teresa, I think we would really like to get the contacts and have them part of this collaborative. That was the initial thought, and then there was. I think it was Randella's, is it her mother that owns an assisted living on the Navajo Nation? I'm pretty sure. And we've never really kind of brought her into this collaborative. I think that would be a really good thing to do. Okay, and let's see. If you have a chance, Teresa, and you could send me those, that would be great. Do we have any administrators on the call at all? Okay, so we're going to just kind of bypass that, and we'll go to the KAI report because we're pretty enmeshed with KAI right now because of the webinars. So, Julie, I don't know if you or Jonathan want to give a little update on kind of what's been happening with the 2 webinars plus the best practice report.
Sure, I can go ahead and provide an update on that. So we did complete the June webinar, and so that is in the process of some of the post-production pieces, and so hopefully that recording will be made available soon. And then we did have our dry run for the July webinar, which is will take place next Wednesday at 2 p.m. Eastern Time. I think we have everything pretty much squared away for that webinar in terms of questions and panelists lined up. We will have Francis Stout, Joseph Ray, Gerald Hodges, Val Crail, and Tammy Reed, who will be panelists, joining Debbie in that discussion on governing board relationships with tribal nursing home administrators. So that's going to be very great. And then the next piece of work that we are doing for the U.N.I.T.E group is we're starting the effort to develop the August report for this best practices series for tribal nursing homes, and that focus is essentially going to be a report out of the dementia survey that was conducted, I believe, in early, I want to say February or March.
Okay.
And
Now,
so
how many best practices reports have we done so far? There was one in December, right?
Yep, we did December, March, and in June. So there's 3 completed ones, and then we do have, and then August will be the 4th.
So March was on dementia, June was on tribal relations, right? And that one hasn't quite hit the website yet, correct?
Correct.
That's correct.
Do you know when that'll hit the website?
It still has to be reviewed by CMS.
Okay.
Oh.
All right. So we're working on an August deadline. So what we had decided, for those of you, if you don't remember, there's going to be these best practice reports 4 times a year. So last year we did our first one in 2016 on traditional foods. And then this year our topic was the dementia and the tribal relations. So we agreed to do kind of like dementia and then tribal relations and then dementia and then tribal relations. So I'm hoping that, honestly, with this webinar next week, that we may actually, Julie, get some feedback that we can use for that final best practice paper at the end of the year. What do you think?
Yeah, that would be great. I think as soon as we're done with this next report, if we can start planning for that final one, I think that would just make the product a lot better. So that sounds good to me.
Right. So there might be, listen carefully, there might be some things that come up, that from audience participation that might be helpful for that. So, okay, good. And let's see. I think you all caught what we said at the beginning, that KI is going to see if they can start sending out these reminders for these meetings so that we get, really good attendance. So just remember, again, our format is, it's always the 3rd Thursday of the month at 12 noon Arizona time. The steering committee is the 2nd Monday of the month at 11 o'clock Arizona time. So in between, what's happening is the 2nd Tuesday of the month is the Tribal Technical Advisory Group call. I think I might have missed that call in July. I was on it in June, but I think I might have missed it in July. I'm not even sure if they had it. And then Joseph Ray is also on that call, and some of you remember Michael Baines. I believe he was on that call in June. And then, so that kind of happens between our 2 meetings, is that TTAG, what we call TTAGs, a TTAG call. And then the last, again, the 4th Wednesday of the month is always the long-term support service webinar that KAI does. So this year we hosted it in June and July. And Julie, you said you're not going to have a webinar in August. Is that correct?
That's correct.
Yes, that's correct.
Okay, and then you'll be back on board in September.
Correct.
So if we want to do this again next year, will you just kind of get back to us like in September with a date and stuff like that?
Yeah, actually, I think, Debbie, I think there's an understanding with John's at CMS that U.N.I.T.E group will have 2 standing webinars every year. Typically, they have been the May and July webinars. However, this year, they were the June and July webinars. So if you have a preference, I think we can, put that forward, and those can become the months that you would do the webinars for next
year.
Sure.
So we'll get some continuity going with that. So that's really good.
Mm-hmm.
Okay.
Mm-hmm.
All right. Anything else that we need to talk about?
Debbie, I'm going to interrupt you real quickly just to let you know an email came through from Sheila apologizing that she is currently in a meeting and is going to be unable to join us.
Okay, good. Thank you very much. Okay, so thank you. I want to thank KAI because they've been working really hard on these webinars, bringing us all together and doing a lot of extra work with IT stuff and, getting the PowerPoints ready. And, I mean, there's just really a lot, and making phone calls, so we can pull our best practice papers together. So thank you, Julie, for all the work you've been doing. I appreciate that.
Thank you, Debbie.
Yep. And then Rebecca Drummond is here to tell us about what happened with the HRSA grant that we applied for.
Hi, everybody. We had applied for a HRSA Rural Health Network Development Grant, which unfortunately was not funded. This was to be a one-year planning grant at about $100,000. The end goal being a strategic plan for the collaborative, which could lead to what they call a network development grant, which are 3-year grants at a significantly higher amount of funding. I think they're about $300,000 a year for 3 years. Anyway, we decided to go ahead and write this application with a really short turnaround, primarily because historically these planning grants came out every 3 years, but now they're coming out every year. So we did just find out fairly late. The start date would have been July 1, and we just had our announcements now. That the idea being that even if we were not funded, we would get feedback from HRSA, and we could have more time then to plan and submit another proposal this year. So that's something to talk about if we want to move forward. The one thing that I have to update is the state offices of rural health are the local technical assistance provider for HRSA with regards to these grants. They did provide us a letter of support, and with enough notice, they could review proposals, or in this case, they can help us review what we did submit and review the reviews. And I did get in contact with them because I kind of wanted to see what they felt about the likelihood of this opportunity being announced again this year, given the current government situation with budget and et cetera. All of these HRSA grants the announcements were delayed quite significantly. People aren't sure about funding, but they seem optimistic that the funding will be there and that most likely the opportunity will be announced again this year. So they are also willing to review the proposal and provide us some feedback. So I guess that would be my recommended next step, just to see how much work would be at hand in order to get organized for another submission. My guess is if there's another announcement, it would be similar to last year. They'll probably announce sometime in November, and then it's due right after the holidays, which was unfortunate. So we really didn't have very much time to plan as a team, to engage the different U.N.I.T.E partners. And I would say that the primary feedback, which was definitely predictable, was when they talk about a service area, we were very generally calling it Indian country. And so when they talked about the data needed for gaps in services and et cetera, we were loosely put in just what's happening with reservations. So we didn't really talk specifically about individual communities and the data that each of the U.N.I.T.E members may or may not have. And then the other piece was specific roles. These network grants are kind of interesting. They want operating procedures or bylaws, leadership structure, decision-making structure, and all of that I think would have happened within the planning grant, but they did comment that there wasn't enough detail about the specific roles of each of the collaborative members. And so that's something that we could talk about and agree upon, and then put a little more strengthen that aspect. Historically, for the network grants that I have worked on here in Arizona, I do work with one group that has now had 3 cycles of the development funding. So they've been funded on this program 9 years now. They did receive this award this time around. And a lot of that, when they define roles, a lot of it is through contracts. The one particular partner is contracted to provide, training and education. Another partner is contracted to provide a policy analysis, whatever and I think in a planning grant it's not necessary, but I think that's the kind of thing that they look at when they talk about clear roles. I don't think it's really necessary for this next time for a planning grant, but we would want to brainstorm a little bit about how we can frame what each of the members would be doing. And in the interest of time, because we only had 2 weeks to pull it all together, there is a requirement to form a network that you have an MOU or an MOA with at least 3 entities. So we pulled that together, and they were the nursing homes, and then we kind of, with all the other entities that are partners in U.N.I.T.E that are not necessarily nursing homes or nursing home facilities, they had a support role. And so maybe there's time to either collect more MOUs for the core network, and then talk about the different roles they can play, or just formalize it a little bit. But a lot of this is speculation. So like I say, I think my recommendation is just that I meet with the Arizona State Office of Rural Health, and they said that they can review our materials probably at the beginning of this month, and then I can collect their feedback and then come back to the group and see if we want to move forward.
Mm-hmm. Okay. And you did say at some point, Rebecca, I remember that some of this money could actually be used for the elders, correct?
You mean direct services?
Yeah, like if we went past the development grants, then some of it could be direct services, correct?
Oh, right. So historically, what was a little frustrating with these network grants is they did not allow for direct services. And so it was much more, how does the network work? And it's interesting because I think a lot of the grants across the country are hospital networks. And here in Arizona, the few that I've worked with are not what they call vertical. They're all the partners are different kinds of organizations. Some are, like an educational organization, or some are a clinic, and some are cooperative extension. So they all play different kinds of roles. And so there's also this piece that's a little frustrating with the grant is sustainability. There's this idea that these networks can generate revenue and support themselves. I don't ever see that happening with the ones that I've worked with. They're going to either keep surviving off grant funding, or they're just going to, but you kind of have to play that game a little bit and explore those ideas. So, but in the past, there were not funding to do even programmatic services. Now, in the past few years, they changed the 3-year grants to include up to 30% of your budget to provide direct services. So historically, the 3-year grants were about $180 a year, and now they're, I think, $3 something a year, and up to 30% can be, what intervention or programmatic services. I'm thinking that what it sounded like the direction that would happen with this group is there was a lot of professional development or training and needs assessment with regards to keeping up to like CMS requirements and things like that. And probably in the end, if we were to go to the next level of the 3-year grant, a big chunk of it could be in contracting for training and for those requirements. Now, direct services to the elders, in terms of a network of 15 or so nursing homes across the country, not really sure how that would work out, but it could. But that's up to the group to kind of brainstorm, I think. But yes, up to 30% can be for what they call direct services, and that's kind of open to interpretation what we mean by direct services.
Mm-hmm. So, does anyone have any immediate questions for Rebecca based on what she just said? Okay. Because I'm thinking a couple things while she's talking. I'm wondering about, first of all, this would be my suggestion, and you can all jump in, is that we have her pursue with the Office of Rural Health, really, picking apart this a little bit, having her go in and get some feedback from them, because I think that's good. If we have our annual meeting, this is something, we were hoping we could use some of this development grant money to kind of help us fund our annual meeting, but we do still have the quest. And so I think that if we had an annual meeting, one of those days, 1 or 2 of those days should really be just, and I don't know, Rebecca, if you're even able to help us with this, but to really sit down as a group with Rebecca, and maybe we could spend some time, really fleshing out exactly what you're talking about, some of these specific rules and things like that, and then go ahead and have the application all ready to go in the late year. What do you think about that?
This leaves that sounds like a great idea to me.
Debbie, when is your annual meeting?
So that's something that we need to talk about yet when, on the next agenda item. One of the suggestions that came up, Nicole LeMay let us know, if you remember our first inaugural meeting was in Scottsdale, Arizona with Banner Alzheimer's Institute. They are having another conference, but it's just a one-day. It's actually in Tucson. And it's going to be at the Pascua Yaqui tribe at the casino there, Casino of the Sun, Casino del Sol. And so it's just a one day, but I actually had emailed Nicole to say, if we had our annual meeting there in mid-October, would it be possible to have, a room, we could stay at the casino and just have a couple extra days just to work with, say, Rebecca on this grant? Because I know people were saying, hey, it's going to be hard for me to get off work if I'm just, coming, for a conference that's not specifically about geriatrics. So if we had one day to kind of get the geriatric piece and then another day and a half to just really get this grant and really put something nice together, I think we could get some money. I really do.
Debbie, what do you mean, though, about not going for one day just because not related to geriatrics? Because if it's Banner's Alzheimer's, is it going to be all about dementia and Alzheimer's care?
Yeah, but it's geriatric focused. But we did talk, for example, we talked about going up to Washington for the National Indian Health Board, but I remember there were a couple comments from U.N.I.T.E members that said, that if you looked at the agenda, it was, maternal child health. I mean, there were other things, and they were saying, I don't know if I can get away for a conference that, maybe looks like it doesn't apply 100% to what I'm doing kind of thing.
Yeah, for sure. That's why I was thinking the Banner Alzheimer's one sounds like a good matching up of a great conference and then doing some work behind that.
And we've been with them before, and to be honest, I know enough people there that I think we could even maybe get someone to meet, one of their physicians or something to meet with us. Or, you know what I mean? We could maybe work out some kind of a side, separate little, workshop or something, maybe. I don't know. I'd have to work on that. But I know Nicole sent out the save the date, and I think I sent it to everyone. I don't know if I wrote it down. I want to say it's, you know what, hold on just a minute, I'll find it. So, I mean, what do you guys think about that? Because I know we're kind of talking to Grant, but we're also talking our annual meeting. Rebecca, would you be available for a day and a half to meet with us? And I may be able to get some funding for your time through the web.
I think so, and you don't know when, right? So it's just a matter, I'm happy to do it. It's just a matter of,
I'll find it. Hold on. I just wasn't. It's mid-October.
Okay. I'm sure I can make it work. And that's good timing, too, because we would have we would have the feedback from State Office of Rural Health, and then we would also be organized for when they make the announcement.
Right. Right, and you're saying the announcement will probably be in November?
It's a guess, but yes, that's typically when it is. And they give about 2 months, so November, yeah.
Okay.
I think it was due like January 3rd or somewhere around there.
All right. Let me see if I can, annual meeting, okay. I have too many folders, that's my problem. Too many folders. Okay, here it is. Let's see, enlarge this. Okay, it's Thursday, October 19th from 7:30 to 4 at Casino del Sol in Tucson. Hotel $129 per night up to double occupancy. It goes up after October 1st. Registration, it's actually limited to 300 people. The cost is only $25 a person, so that's pretty reasonable.
The conference cost is only $25?
Yes, it's going to be Dr. Burke will be speaking, Lori Nissen, Nicole LeMay, who's their Native American contact. Let's see, here's the conference objectives. There's the Autumn Foundation is sponsoring it. I'm not sure where that is. Let's see. They're going to talk about Native caregivers throughout the dementia journey, normal aging versus Alzheimer's.
So, Debbie, I'm just going to interrupt you real quick. I'm looking on my calendar. It looks like October 19th is a Thursday.
Yeah.
So it might.
So what could we do, like a Thursday, Friday, Saturday? What do you think about that? Thursday, Friday, half day Saturday, or would you rather do like maybe half day Wednesday, Thursday, Friday? I mean, for those of you coming from out of town, what makes sense for you?
I'm thinking Thursday, Friday, but it depends if we need that extra. If we need a day and a half, then where do we put that?
Well, if you did half day Saturday, you could fly out like later on Saturday. The casino is not that far from the airport. Okay, Tucson's not that big, and the casino's not that far from the airport. So you could do a Wednesday, Thursday, Friday night stay. We could do a morning on Saturday, say our goodbyes, and then you could fly out sometime on Saturday. And we could probably come up with some kind of activity for everyone for either Thursday or Friday night. Where we'd have some time just to connect,
Yeah. That seems doable. I don't know if I'm going to be able to attend or not. That's kind of up in the air depending on budget and stuff. And I think we want, ideally, I think it'd be nice if we get more than just you and me kind of at the table. So I would love to find a date or whatever is going to work best for the larger group. And we don't have very many folks on the call today, so I hate to make a decision just based on me because I'm not even sure if I'm going to be able to go.
Okay, yep. I hear you. I'm going to send something out on this. Any other feedback? I know there's not too many of us on the call, but I'll send some feedback, Lisa, and see if this would work and see who. I'll just say I need to know. I need to know, and if we could get everyone together, I think it'd be great. The other thing is we've got access to Zoom and things like that where people could attend, like our work with Rebecca on the grant could attend remotely and have their feedback, either call in or do like Zoom where we could see them and they could be part of that. You know what I mean?
Yeah.
So we'd have everyone's feedback. So we could do a remote meeting possibly on Friday or Saturday morning. So that's a possibility. Okay. All righty. Thank you, Rebecca. So I would say, are we all okay with Rebecca at least going and getting some feedback from the Office of Rural Management?
It's the State Office of Rural Health. It's part of the University of Arizona.
Yeah. I think that would, Rebecca, I think you're good doing that. And
okay, and I put the October 19th in my calendar. I could do any portion of probably Thursday and Friday. Wednesday I wouldn't be able to because I teach.
It would probably be Friday and maybe Saturday morning is what I'm thinking.
Okay.
And then Lisa, could we do possibly a Survey Monkey with just like 2 questions saying, we're considering having our annual meeting on this day at this time. Would you be able to attend? If so, could we put together like maybe a 2-question and just see if we can get people to respond, see who might be willing to fly to Tucson?
Sure. If you'll share the information with me so I can include that in the Survey Monkey, that would be great.
Okay. And just see what feedback we get from all our members. And then if you do that, I'll also send out an email saying, here's what we talked about at our monthly meeting and here's what we're thinking about and see who we can get.
Sounds good.
Okay, let's do that. Okay, Rebecca, thank you very much. I appreciate that. I'm just going to make a couple. I have not been able to connect yet with Cynthia to try to get a Title VI person on this call, but I will. And the other thing I wanted to mention, and again, we'll have to involve the Geriatric Workforce Enhancement Program with the University of Arizona into any plans that we're making, because I know they do have some funding to help us. And since they're right there in Tucson, it might be easier. They may even be able to come over and send a speaker from the university for Friday or something. So that might actually work out really well. So I just wanted to remind everyone that the GWEP does what they call care partner sheets. I send those out. So there's elder care provider sheets, which are more for professionals, and then there's care partner sheets, which are more for caregivers. and they're asking me as faculty on the GWEP to get at least 5 or 6 authors, people that are willing, and there's a template and everything. It's not that difficult. But if you're in this collaborative, you're considered an expert in geriatrics, and if you could pick a topic that would be related to something that affects the caregiver. So if you were a caregiver taking care of a loved one at home or in assisted living or something like that, what would you want to know about, and what do you feel qualified to write on? So if there's anyone, Teresa, that would obviously include you as an ombudsman, that would like to pick a topic, and I'll send you the template, just let me know, because I need to try to figure out 5 or 6 people who are willing to do this. It did not take me more than 2 or 3 hours to write this.
Debbie, this is Lisa. I think I shared with you the Reach into Indian Country training, dementia training that for caregivers that I've been going through, and I believe I shared the contact information. But I'm almost done with that training, and it's really geared towards supporting caregivers. So I think I might be able to help you out with one of those.
Okay, that'd be awesome. Just give me a topic, and I'll send you the template. Okay, they want it by April 1st, but obviously they don't want everyone to wait till April 1st. So anytime you could get it to them between now and April 1st would be fine.
Sure, if you could send me the template, that would be great.
You bet. I'll do that. Thank you for volunteering. And also, Lisa, I want to give you time to give a QIO update. I did play phone tag with Barbara Higgins. So I have her number right in front of me. I put it on my phone, so we are going to connect soon. She was out. I think she was out for almost a week. So
she has been out.
Yeah. So go ahead and give us a QIO update too.
I think last time I just reported about the dementia training that we're bringing to Alaska. I'm very excited about that. But just as a sidebar, I stumbled upon something called Reach into Indian Country. And it's an intervention, it's resources for enhancing Alzheimer's caregivers' health. So it started out as grant funded with the VA and expanded. I signed up for it thinking it was just sort of a webinar training that I was going to listen to, but it's one-on-one coaching, training, mentoring, beautiful handout, very, very thorough. I'll have my final coaching call on Monday with Barbara, and I did share the information with Debbie because, again, it's not something for my nursing home group per se, and that's who I work with, but my angle is a healthy, well-adjusted caregiver, whether it's a CNA or, a daughter taking care of a mother at home, whoever that caregiver is, any tools and resources that we can do to support that person because it is such a challenge taking care of someone with dementia. That's why I went through this training. But I would encourage folks, and I can pass along the contact information to Debbie again, that this is completely free. The grant funding, I think, goes away next year. So if you have caregivers, especially in remote areas, that are needing support, I would encourage you to reach out to Barbara Higgins at, I don't even know what university it is now that I think about it.
It's Tennessee. It's in Tennessee. I have I printed it out. Hold on, I think I have it right here. Because I need to call her. I put her number right on my phone too, so I could call her when I was driving. I can send that out, Lisa, to everybody too, and just encourage them to consider that resource.
Well, I think of someone discharging from Archie Hendricks.
Yeah.
That could be out in a rural place and might need some extra support, that might be it. And of course in Alaska we've got folks like that all over the place.
So my question is the training about support? So this isn't like a certification where you could get your caregivers certified. This is just a way, like teaching you how to support your caregivers. Is that what that is?
It's when I'm done with this training, and of course, like I said, it's kind of different in the model where I work with nursing homes, but the ideal would be that I would be able to go out into the community or to find those folks that are needing that extra support. And actually, I had just someone that I work with in a completely different area mentioned that she has a mother with Alzheimer's and she was struggling with some behaviors, and so I asked her if she would volunteer to work with me on this training, and she was very excited for that. And that's someone here in the Anchorage Bowl, but still, it's a way for me to go into their house, into their home, meet with the caregiver, and identify what are some of the key issues for you, the caregiver, to support you, to support the resident or the patient. So things like the risk assessment, making time for yourself, taking care of yourself, your own health, that sort of thing. A lot of tips on that kind of support.
Right. So you actually become, once you get the training, you become a community program coach, correct?
Correct.
Okay. So I found the flyer. There are trainings, upcoming training dates, July 28th from 2 to 5 Eastern Time, Wednesday, August 16th, and Thursday, August 31st. The REACH program is available to help family members caring for loved ones experiencing memory problems. And is there someone in your community who wants to become a REACH program coach at no charge? That's what Lisa did. Your REACH program coach will then be able to provide needed resources to family members caring for elders or loved ones with memory loss. So I could see, like, you know, maybe an assisted living staff member becoming a coach because there's a little more community, you know, connection there. Barbara Higgins, Higgins. It's B, like boy, Higgins, or I'm sorry, B, Higgin, Higgin, the number 1, at UTHSC.edu. I think that's the University of Tennessee
Health Science
Center, probably, yeah. And her number is 901-523-8990. Dial number 1 and extension 5078. So that's Barbara Higgins, and I am in training. And I gave her contact information to Nicole Lomay because Nicole is community outreach for Banner Alzheimer's Institute. So I did give her contact information to Nicole too.
Perfect. I shared with the folks, you know, I gave it to Jordan and Teresa and other folks that I connect with that touch people more in that community-based setting. So, and, you know, like I said, this is free and it's going away. So I just want to make sure that folks know that this is out there and encourage those caregivers, you know, to support those caregivers where you can.
Right. So I thank you for that. I will send the link to that program out to everybody too. So, okay, this is sounding really good. We got some work to do. Just encouraging everybody to stay connected, please. I've been getting some calls from Alaska, which is really cool. Gerald called me the other day. It was nice to hear his voice. Bill called me one day. And I think doing these webinars have been really good experiences also. We're just kind of bringing our collaborative together. So just really encouraging everyone to, you know, call someone on the collaborative once in a while. Send an email. Say, hey, I noticed you haven't been on all the, you know, calls, or we'd sure like to have you, or, you know, whatever. Let's just, you know, keep working at this. And we'll get Lisa, you send me those minutes. I'll get them typed out and sent out. I just realized I never sent out the steering committee meeting minutes. I did get a text while we were talking from Leo Litsky, who was our former administrator here. He's still part of this collaborative. And he did say that assisted living has always been part of home and community-based services, not so much institutional care. And Lee has lots of years of expertise, so that's good to know. It doesn't mean they can't be part of our collaborative, but it, you know, just historically, that's probably more how it's been. So, all right, Teresa, you need to recruit us some ombudsmen. Is she still on the call? I don't know if she's still on the call. Okay. All right, everyone. We'll talk soon. Have a great rest of your day.